Good day everyone, I am Dr. Sadiq Azam and I am a consultant cardiologist from Hyderabad. In today's video, we will discuss a symptom that is very common both in heart patients as well as in lung patients, and that is breathlessness. So, breathlessness is the feeling where you're doing regular activity and you feel short of breath. So you're just feeling like you're not getting enough oxygen. Patients say that I feel I'm not having enough oxygen. I have to take a deep breath. So this is breathlessness. Now this breathlessness can be because of lung issues like COPD, interstitial lung disease, pneumonias, infections, or it can be a sign of a cardiac disease as well, because when you have decreased blood supply to the heart, that can also present with breathlessness. Or when the heart pumping decreases, a condition known as heart failure, which causes fluid buildup in the lungs, then also you can have breathlessness. So how will you know whether your symptoms are due to the heart or your symptoms are due to the lung? Well, you have investigations like X-rays and 2D echoes and ECGs which will help you make this differentiation. But at home, how can you to some extent guess whether should I go to the hospital to a pulmonologist or should I go to a cardiologist? Now, if you have remember these are broad terms, these are broad categorizations, but there's always an overlap. There's no hard and fast rule that this is the only way a heart patient will present, this is the only way a lung patient will present, but this is in majority of cases. Now, if you are having breathlessness more triggered by weather changes or by dust, or every winter you get breathless, or you have breathlessness, you have a history of asthma or lung disease, or a history of some exposure to some allergic components, or you have fever associated with your breathlessness, you have cough with sputum coming out, sputum yani spit with yellowish color phlegm coming out. Now these are all signs of a lung problem. Cardiac breathlessness is mostly present at exertion. Matlab, at initial stages, at rest you will be fine, but when you start walking you will feel breathless. When you start going up the stairs, you will feel breathless, and most importantly, you will feel breathless doing things which you were able to do very comfortably before. For example, if I am used to climbing 2 floors normally, and then suddenly I start feeling breathless while climbing even 1 floor, that is something to worry about. Second thing is, you might get breathless while sleeping. While sitting you're fine, you go to sleep, suddenly you feel breathless. This is also a sign of heart disease. Suppose you go to bed normally, but then you get up in the middle of the night feeling breathless and you have to get up and walk to the window to take fresh air, which relieves your breathlessness. This is also a sign of heart disease. So breathlessness is also a very important symptom of heart disease. Very often patients think breathlessness is only related to lungs. Absolutely not. Breathlessness might sometimes be the only symptom of a cardiac disease. So don't ignore this symptom and make sure you consult your doctor if you have any of these symptoms. Thank you.